Welcome, and thank you for joining us for another Ask an Expert with TGH live Q&A series. I'm Danielle Kachi, Public Relations Manager at Tampa General Hospital, and I'll be your moderator for today. Today, our conversation revolves around pickleball, the fastest growing sport in the U.S., and with increased participation, it can lead to injuries. Tampa General Hospital is the region's only level 1 trauma center, and our nationally renowned surgeons have experience treating the most complex orthopedic conditions with superior outcomes. The Orthopaedic Institute offers the latest minimally invasive options for joint replacement procedures, including knee, hip, shoulder, and ankle replacement. We're very excited to have Dr. Craig Radnay, an orthopedic surgeon with Florida Orthopaedic Institute and Tampa General Hospital, join us today. Welcome, Dr. Radnay.
Hi, Danielle. Thank you for having me.
Great. Thanks for being here. But before we start, we do want to discuss some housekeeping items for the audience. If you have any questions during the live session, place those in the comment section of this live event, whether it's on Facebook or YouTube, and please try to keep them general and we'll do our best to get to them. We did have many questions pre-submitted since this was such a hot topic. We also do want to remind you that although we're talking with our subject matter expert today, you should always consult your primary care provider for individualized medical advice. Let's get the conversation started. Dr. Radnay, can you elaborate on the most common injuries you see come through your practice pertaining to pickleball?
Right, so that's a great question. As we know, pickleball is becoming an increasingly very popular sport. So this year, there are going to be more people on a pickleball court than going down a ski slope. So it's pretty hard to believe. So a very popular sport. You can get injuries as well. So occasionally you can get your fractures, your broken bones. You could get tears, Achilles tendon ruptures. But by far, the most common injuries that you will encounter in pickleball are really overuse injuries. A lot of the times it's because people still are not used to playing, or they're just starting to play. They haven't really conditioned themselves. They haven't necessarily stretched, and they get these injuries over time. But it really can affect the whole body. So it can affect all the way from the ground up. So your feet, you can get bone contusions in your heels. You can get plantar fasciitis. You can sprain your ankle. You can get Achilles tendonitis. You can get strains of your calf, of your hamstring, of your quadriceps. You can strain your knee. You can hurt the meniscus, the ligaments. You can strain your back. You can certainly strain your wrist, your elbows, tennis elbows, your rotator cuff. Obviously, you have to be careful even of direct impact of getting hit with the ball in your face, and you could hurt your eyes. So really doesn't spare any part of the body, but fortunately, most of these injuries are easily treatable.
Great. Well, appreciate that overview, and we'll get through some of those injuries in just a second here. We did want to start with some pre-submitted questions from our participants. One question we saw a lot of is that multiple people want to know what is the best type of shoe to play pickleball in, and if there's a difference between one sneaker versus another.
Right. So that's another good question, because certainly want to prepare yourself to play in terms of conditioning and flexibility, but then you want to make sure you have the proper equipment. So shoes are obviously very important because there's a lot of running, and it's not just running forward and backwards, it's a lot of side-to-side lateral movement. So a typical running shoe, while very comfortable, is not a good shoe to use when you play pickleball, mainly because it's designed for straight ahead activity, so forward and backward. So to account for some of the lateral motion, you really need what's called a court shoe, such that you use for tennis, or a cross-training shoe. And those shoes in general have a much more rigid sole, so it doesn't move as much, it's not as flexible. And they always usually have more support within the shoe, specifically to help with lateral motion.
Good to know. Okay, court shoes or cross trainers. Got that. Another question that came in multiple times: what are the best pregame stretches for the ankles and feet?
Right. So for pickleball, again, it's important for the conditioning, but also flexibility. And flexibility is important for your prevention. Your warm-up is flexibility and core strength. So specifically, you want to focus on your calves and hamstrings. So calf stretches, Achilles stretches, hamstring stretches, low back stretches, very, very important. And core strengthening flexibility is also important too, because you're going to be running around the court. You're going to be in positions you're not used to being in. You're going to be lunging, turning side to side, maybe even diving. So the more flexible you are, the more that you can hopefully avoid injury.
Good. Lots of stretching. We will all remember that one. Frank writes in that he ruptured his Achilles while playing pickleball, but has been cleared to get back into it gradually. He says, "What can I do to prevent re-injury besides wearing the correct shoes and stretching beforehand, like we just talked about?"
Right. So sorry to hear about that, Frank, but fortunately, we have many good ways to treat Achilles injuries these days. And it depends a lot of times on the patient and other surgical factors in terms of deciding surgical treatment versus non-operative treatment. But either way, the anticipation, the expectation would be to get you back to the activities that you're doing prior to the injury. And certainly there's a recovery process that first is, it will involve a period of immobilization just to let everything heal. And then the next phase usually focuses on more flexibility and stretching, a lot of which we just discussed. And then the final phase really works on strengthening and really functional improvement to get you back to full activity. So that really the full recovery can take somewhere between 6 to 12 months. But the expectation would be that most people should be able to get back to their pre-injury level activity.
Good to know. Another foot-related question here that we got. Someone asked, when I play, that their arches hurt. There's a sharp stabbing pain. What causes that?
Right. So that is commonly heard, really a lot of sports, but a lot of sports where you have that start-stop type of activity. And it really could be a bunch of things. So it could just be that you're a little tight and you just played a sport and you're a little sore, and that can resolve very quickly. It could be an injury or an inflammation to your plantar fascia, which is a tissue that helps support the sole of your foot and kind of starts at the heel and fans out. And so sometimes that can get inflamed. Sometimes you can even have a partial tear. So that can be a little bit of a sharper pain. That typically would get better if you modify your shoe wear, modify your activities a little bit, work on some flexibility. That can hopefully get better in a relatively short amount of time. But sometimes it can last a little longer. Sometimes it can even be a heel bruise or even a stress fracture of your heel bone. Because again, pickleball does have a lot of repetitive movements, a lot of running around on a hard surface. So sometimes people may overuse it and injure their bone. Also, as we get more mature in age, sometimes people's bone density isn't as strong, won't support as much, and they can get a stress fracture from that as well.
Good to know. Another question we had come through, someone's asking, what is the difference between having normal post-game soreness versus symptoms that linger, and that's when they need to see a doctor?
Right. So a lot of this, I mean, everyone's pain threshold is different. So in general, it's not always no pain, no gain. So in general, if you have a little bit of soreness, a little bit of swelling, I think that can be related just to the activity itself. So certainly you should be able to rest, you should ice, you can take anti-inflammatories, you should probably maybe decrease the frequency you're playing. And that usually maybe lasts 24 to 72 hours. If you have pains that last longer and you've done all those things I mentioned in terms of resting, and or if you have a really sharp pain or difficulty walking, difficulty getting back to your other regular activities, then you might be a little bit more concerned. And then you should probably come in and see an orthopedic provider.
Sounds good. Another question we had come through, someone writes, the next day after I play, my heels hurt when I take my first few steps after standing up from a chair. What's causing that to happen?
Right. So I've had that before too. So that's usually typical with plantar fasciitis. So again, a tissue that helps support your sole. It can get aggravated when you're running around because you're basically stretching out your arches when you're playing. And so specifically when you start up getting out of a chair, when you first get out of bed in the morning, those kind of things can really cause a lot of pain because your foot is stretching when you first hit the ground. So again, most of the time this is transient pain. Usually gets better if you modify your activities, if you're able to put some more cushion into your heel and your shoes. But the most important thing is stretching. So little things like before you get out of the chair or before you get out of bed in the morning, just throw a sheet or something around your foot and pull back, stretch out the foot for 10 seconds before you get up and take that first step. That can make a world of difference. But in general, some of the stretches that we talked about before, like calf stretches, hamstring stretches, the more flexible you are, typically the less often that will happen.
So a little bit of stretching before and after potentially.
Goes a long way.
Yeah. We do want to remind everybody, we're happy to take your live questions. Go ahead and put those in the comments below. We do have one more question that came through from our pre-submitted questions. Someone wrote in that they played pickleball a couple days ago. They felt their usual soreness after the game, but now they're feeling a dull pain in their ankle and heel when they walk. They're asking what might be causing that.
Right. So initially, dull pain can be a little bit less concerning than if it's sharper pain. If you're still able to walk, a little bit less concerning than if you can't walk. So most likely, again, it was an overuse from playing. So I think that, again, trying to rest, trying to provide some support. In this situation, when it involves the ankle, you might consider some taping or an ankle brace. If you notice that there's a significant amount of swelling or discomfort, it's not getting better, again, I would recommend seeing a provider for additional evaluation to make sure it's nothing more serious.
Good to know. Thanks for all those updates and answering all those questions. We had a lot. We told you it was a hot topic. So appreciate you, Dr. Radnay, for such a great discussion today. We do want to remind you that you can find out more information on the Orthopaedic Institute at Tampa General Hospital. You can do that by visiting tgh.org/ortho. We thank you to all those who have joined us live today. We look forward to seeing you at the next Ask an Expert live Q&A session. Have a great rest of your day.